Hello, we are Access to Success.
Welcome to a concise demonstration of our dental management system.
In the next 15 minutes, we will walk you through the two main areas we'll use every day.
Administrative management and operational management. To show you each form,
We will explain what to fill and why, demonstrate the end-to-end flow from appointment to treatment and to billing.
so without further ado, come on and let's get started.
So for a quick overview, the system is organized by the main menus. Under administrative, we manage the scheduling appointments, billing, and inventory. Now we'll go back and let's look at the operational where we'll manage the patient profiles or patient records. Everything is linked by the patient ID for a single source of truth. So let's go back and let's go to administrative. So for the administrative management, we'll first have the scheduling or appointment. This is where appointments are created and tracked. First will be the patient name, where we will write our first and second name, date and time, which will be the appointment slot. We'll set it for today. Contact number is used for confirmations and reminders. Reason for visit can be an example, cleaning or extraction. So remember that you should always write only until the minimum value. Reason for visit is either example is cleaning or extraction. We'll write cleaning, and for the appointment status, we can write completed. And finally, the patient picture. We'll just add a patient picture right over here. And then there it is. Then we have for here below. You can either save the record, add a record, delete the record, or find other records in the forms. Now, let's save the record. And then let's go back to billing. Next is billing, where each billing entry ties to a patient and a date of service. Again, we'll write the patient name or the patient ID. The ID, we can write here what is stated. For now, we'll write the student number. Next is the date of service or when procedure occurred. Then the payment status, which can either be paid, unpaid, or partial. We'll write here paid, and then for the procedure or treatment type, let's write cleaning. And then finally, for the total cost, this is the auto-calculated if fees are predefined. We'll write here 1,000, and next is we'll add the picture of the receipt. This is where we will upload our audit trails. Finally, saving a billing record updates the patient balance and marks the visit financial status. Next is the inventory management. The inventory will keep track of the supplies and materials that we used in the treatment. First is the item name. This is used clear codes to reduce errors. The item code and then the current stock, where we will write the actual quantity that we have right now. We can update this every time. And then we'll switch to supplier details. First is we'll write the supplier name. So here we have Dental Smiley, contact number of Dental Smiley, and the cost per unit, or how much one piece, bottle, or item costs. Again, for the contact number, let us follow the minimum value. And we will next attach the purchase receipt. Receipt open, and then let us close the form.
Now, let's move on to the operational side of the dental management system. Under the operational management, we could see the patient record. Under patient record, there are three categories: patient profile, patient history, and treatment and clinical record. Now first, let's fill out the patient profile. First, we have to fill out the emergency contact. Now, we can now fill out patient ID, name, age, sex, date of birth, address, contact number, and the emergency contact number that you have already filled out earlier. Once that is all done, you can now save your record and go back to the patient record. Now, the next form would be the patient history. For patient history, you must fill out the last dental visit, the previous procedures, allergies, medications, and medical conditions. In addition, documentations, which is optional. Once that is filled out, you can now save your record and go back to the patient record. Now for the third form, which is the dental chart. Under the dental chart, here you can see the positions of each teeth and the conditions the dentist diagnosed during the dental visit. On the right, you would be able to see the legend and symbol to be used to fill out the boxes. Once that is done, you can now save your record and go back to the main menu. So, that's it for Access to Success Tour of the Dental Management System. For a live demo, database schema, or to adapt this form to your clinic, contact us at dentalsmiles@gmail.com. Don't forget to like, subscribe, and ring the bell for more demos. Thanks for watching!